Yeah, it took an active God basically in the court system to get me to change. I was one of those folks that I didn't have the ability to stop on my own. I had to be made to stop by the court system. So I got court ordered to treatment in 2018 for a probation violation. I got a chance from the judge. He said, Mr. Bowman, everything on your record is alcohol and drug related. We can either send you to jail for 30 days or we can send you to treatment for 30 days. And at that time, it was no fun no more. And I was ready to stop. I just didn't know how. So I was like, I'll take treatment. And that 30 days ended up turning to 13 months in a treatment center.
The overdose crisis is a story that touches every corner of our communities. Yet too often, it's treated as something separate from the broader conversation on public safety. But tackling this crisis isn't just about policing. It's about changing the way we think about public health. Meet John Bowman. John is the senior campaign organizer for Dream.org. John is a person in long-term recovery and formerly incarcerated. John's extraordinary journey from addiction to becoming an advocate for change exemplifies his resilience, compassion, and unwavering commitment to making a lasting impact on society.
So today we are here for the Public Health is Public Safety Virtual Lobby Day here on Capitol Hill. We're doing virtual meetings on Zoom and also some in-person meetings and hybrid meetings with senators today. We're really looking to go from a system of incarceration and punitive measures to a system of care, where we care about individuals, we care about communities, we're caring about each other instead of, our jails and prisons being our biggest treatment providers and mental health providers, actually getting those resources in place so folks have those resources on the ground. Recovery is so much more than stopping use. There's a mental aspect that goes with it. There's that lack of connection. It's not just, hey, let's lock these people up and that's going to fix it. That's not going to fix it. It's going to make matters worse. You're just adding more trauma onto already traumatic situation. And people say that, marijuana or alcohol is the gateway drug. The actual gateway drug for people is trauma. That childhood trauma. My father was an alcoholic from the time before I was born till I was 9. And he ended up having a stroke. So from the time I was 9 till I was 13 years old, I had to take care of my father. Now I didn't have a normal childhood. I had to grow up really fast. When I was 13, my dad got put in an assisted living home. And at that point in my life, I kind of went wild. Started experimenting with drugs and alcohol. And it just progressively got worse through the years. I work with some amazing people at Dream. I didn't even know this life was possible for someone with a background like mine. I'm a 3-time convicted felon. I didn't know that they would allow folks like me in these buildings up here on the Hill or in my state capital, and hearing their stories and the things that they went through, it really inspires me to keep going. And then the folks I work with on a daily basis in Kentucky, we have so many more similarities than we do differences. And it doesn't matter, if you're black, white, red, brown, blue. It doesn't matter if you're a Democrat or Republican. These are issues. These are people issues. These are not one subset of people issues. These are across the country issues. And we need to look at it like that, especially when it comes to addiction, when it comes to, harm reduction, recovery, re-entry. All these things are people issues. And we need to look at it through that lens, through a lens of love. We'll get more done if we work together than we're going two separate.
But yeah, I think as long as we can keep doing what we do at Dream, which is working in bipartisan, getting bipartisan support on our issues, I think we'll be okay.